Childbirth, also known as labor and delivery, is a natural yet highly complex process through which a baby is born after completing its development inside the mother's womb, and it represents one of the most important events in human life. The process usually begins with early labor, where the body starts preparing for birth as the uterus begins to contract in a slow, rhythmic, and gradually increasing pattern. During this stage, the cervix, the lower part of the uterus, begins to soften, thin out, and slowly open, a process known as dilation, which is essential for the baby's passage. As labor continues into the active phase, contractions become stronger, longer, and closer together, helping the cervix dilate from about 4 centimeters to the full 10 centimeters required for delivery at the same time, and the baby typically shifts into a head-down position, aligning itself for movement through the pelvis and birth canal. In a hospital environment, medical professionals carefully monitor both mother and baby using devices such as the CTG machine, which tracks the baby's heart rate and uterine contractions to ensure safe progression of labor. During this time, the mother receives continuous support, which may include breathing guidance, emotional reassurance, fluid management, and pain relief options such as epidural anesthesia, depending on her condition and preference. As labor advances into the second stage, the cervix becomes fully dilated, and the mother begins active pushing with each contraction, using controlled effort to help the baby descend further through the birth canal. This stage requires significant strength and focus, and as the baby moves through the pelvis and reaches the point where the head becomes visible at the vaginal opening, a moment known as crowning. With careful assistance from healthcare providers, the baby's head is gradually delivered first, followed by the shoulders and the rest of the body in a smooth and controlled manner. Immediately after birth, the newborn takes its first breath, marking the critical transition from fetal life inside the womb to independent life outside the body. The umbilical cord, which has provided oxygen and nutrients throughout pregnancy, is then safely clamped and cut under sterile conditions. Soon after delivery, skin-to-skin contact is encouraged, where the newborn is gently placed on the mother's chest, helping to stabilize the baby's breathing, heart rate, and body temperature while also strengthening the emotional bond between mother and child. Following this, the placenta is delivered, and the uterus begins contracting to gradually return to its pre-pregnancy size, which is an important part of natural recovery. Medical staff continue to closely observe both mother and baby during the postnatal period to ensure proper healing, stability, and overall well-being. This entire journey of childbirth is a powerful combination of biological precision, physical strength, emotional endurance, and medical care, making it one of the most profound and life-changing experiences in human existence.